this recording with the PowerPoint about a week later. These all go up on our YouTube page for you guys to review later, in addition to the PowerPoint and any other associated documents. I'll also leave time at the end of the meeting for questions as well, where people can unmute themselves and we can chat about anything that is discussed here. So I am going to share my screen. I am going to assume everyone can see that. Is that a correct?
We can see it.
Awesome. Thank you. All right. So just a quick overview of our agenda. Just going to talk a little bit about the rate increases that took effect as a result of the most recently passed biennium budget on 1/1. A little bit about the Ohio ISP. Matt Klink is going to share some MUI information, local billing, MedCert stuff, and some stuff around the training, and then just some additional information around the upcoming total eclipse and how that may impact Summit County and frankly some services on that day. And then we'll leave time for questions or any other updates folks may have. All right, so I know we have spoken here about the rate increases a few different times. We've continued to get some questions around them. And so we just wanted to talk through, as a result of the budget that passed in last year, there was significant increases to a majority of waiver services. And some of those took effect on 1/1, and that was about a 35% increase on most of the services that many of you provide. And then there'll be another 8% increase on 7/1. All of the updates to the authorizations have already occurred, so you should be seeing increased service rates on your authorizations or additional dollars. I will say, please be careful if you are just used to billing those old rates. If you bill DODD for the old rates, DODD will pay you for the old rates. We have sent out information relative to what the new rates are. There's a link in the PowerPoint that we will send out that has all of the specific rate increases based on the services that you may be provided. And then once again, another rate increase will occur on 7/1, which will be an additional 8%. On the rates from last year, so a total of a 38.08 increase for services. And so you'll also then need to adjust the rates that you are billing as well, and those authorizations will be updated at that time too, so that they're available for that billing. So just be aware of that if you have not yet billed this year and may just be using some muscle memory to bill the old rates. Please be mindful and check those rates on the website so that you can be compensated for the updated rate that occurred as a result of the passage of the budget. I will also say Summit DD on the local side mirrors the Medicaid rates. So our rates for locally funded services also were increased and will also then be increased again July 1st to mirror Medicaid rates. Oops. All right, so want to talk about the Ohio ISP. As you guys may be aware, DODD is implementing a single statewide assessment and ISP so that various counties do not have their own format, do not have essentially their own process. Over the course of this year, Summit DD SSAs will be converting and transitioning to the new Ohio ISP. This will also require a change to how providers access the ISP. So during this year, depending on who you are serving, there are going to be folks that still have kind of Summit DD's ISP, and that will be accessible through iData and how you have accessed ISPs for years. And then some, as they transition to the Ohio ISP, will then be accessed through the Ohio ISP state site that is being administered through DODD. You will know this because at team meetings, through conversation with SSAs that support the people you support, they will talk about the transition to the Ohio ISP. You should also, when someone gets an Ohio ISP or transitions to the ISP, you will get an email from the Ohio ISP system letting you know that there's an updated ISP, very similar to the emails that you're used to through Summit DD's iData system. But it should not be a surprise to you. You should not be wondering where someone's ISP is, whether it's in the state site or within Summit DD's iData system, because you will have participated in a team meeting where they would have talked about converting over to the Ohio ISP. There is a statewide system where eventually everyone will access Ohio ISPs. The link is there, and you can access those, and we're going to show some screenshots on how to do that. And there's also a tip sheet available on DoD's website around accessing the Ohio ISP. However, if you go to the Ohio ISP webpage, it is going to look like this. And you can simply click on plans. You can use the search bar. There's some additional information at the top ribbon as well. But once you go into plans, what you are going to see is kind of this page. And if there are any current ISPs for people that you support, they are going to be listed here. I want to note, they will only show up on this page once the span starts. So if you are looking for an ISP that was finalized, 15 days ahead of time so that you can see it, that is actually accessible in a different area for which we'll talk about here in a minute. What you're going to see here is just current ISPs that are available because their span has started, not ones that may have been finalized prior to the span. This is just how the system is set up. The state is controlling this system and has designed it themselves. And so want to be clear that that's just kind of how they have decided to manage how people access ISPs. It is not, this site is not, was not developed by Summit DD. Once you click on those plans, you'll be able to click through with an example of the ribbon here on the various sections of the ISP. If you want a PDF form, that's also available. However, the PDF form is only available for plans that are within the current span. So if you want to print a plan that has been finalized, but the span hasn't started yet, unfortunately, you're not going to be able to do that. You're going to need to wait till the span start date to be able to go in and download a PDF. However, on the left of the screen, or on the right side of the page, you're going to be able to click on the individual's name and then see PDF versions in addition to any other attachments like eating guidelines or other information that is relevant to providing services to that individual. We are just starting to transition the Ohio ISP, so a majority of plans are still in Summit DD's iData ISP database. So do not be concerned if you have not had these conversations with SSAs or teams around transitioning, or if you happen to log in and not see any ISPs for the people you support. This process is just getting started. So most likely the majority of people that you support are still having Summit DD's ISP within the old way that you would access them. To my point about accessing plans for spans that are just coming up, you'll want on the ISP site, you'll want to click related, and then you can scroll down to ISPs and you will see plans that are finalized, but maybe the span hasn't started yet. And that's where you'll be able to view plans that are not available on the other screen. We'll continue to talk about this. We know it's a huge transition. We know the site at times can be a little bit difficult to navigate. So we will continue to provide resources around how to navigate the state site. And then as plans are added to the state site based on those plans getting transitioned over, you can certainly reach out to provider supports if you have questions, and we can certainly help you. I want to talk a little bit about accessing ISPs for Summit DD's system and the state site. So as we talked about last year, we had a lot of users in Summit DD's iData system. So how the provider portal and how you currently access Summit DD's ISPs who had not logged in a long time. And the county had identified that as a data security issue that we needed to address. So on January 2024, a password reset was sent to all users who had not logged into iData in the last 6 months. All that required was a resetting of your password, and then you would continue to be able to log in. Users who had not logged in for at least 13 months, which if you are serving anyone should not have ever occurred because you would have been accessing a plan every 12 months, were deactivated. So if you do go in to log in and you are deactivated, please reach out and we can certainly reactivate you. And then you may have seen the email if you had not logged in the last 6 months to just reset your password. There's a web-based reset password button on the iData site that you can easily change your password. Now, on to the box to your right next to this one is if you know that somebody has finalized an ISP in the state site and you log in and you do not see it, please reach out to us. There have been some issues with uploading ISPs to the state site where that ISP doesn't show up for some reason. There's some technical glitches. It doesn't always happen, but it can. Please reach out to us, and then we will ensure that you get a copy of that ISP. We do not want you to log into the state site knowing that there is a finalized ISP that you need to access, that you know is in the Ohio ISP system, and it not be there, and then you not be able to have access to that ISP. You as a provider need that ISP, so if you log into the state site, it's not there, please call us, and we will ensure that you get a finalized copy of that ISP if for some reason there was a technical glitch at the state site. All right, questions. If you have questions about services, authorizations, anything relative to the type of services you're going to provide it, as a provider, how they're outlined in the ISP, please don't ever hesitate to reach out to the SSA, have those conversations. You're a valuable member of the team, and please ask questions and work through so everyone has a good understanding of how to support the individual, and you as a provider have a really good understanding of the services that you're expected to provide, how they're documented in the ISP, and that all the authorizations are accurate. If you have questions about accessing an ISP, whether that's Summit DD's iData system or the Ohio ISP system, or other provider support stuff, please don't ever hesitate to reach out to provider support. We are happy to help answer any questions that you may have. If you are having trouble getting into the state site, we don't manage that, and you'll need to reach out to DODD to be able to receive technical assistance with accessing the state site. And that's just the Ohio ISP site. If it's the Summit DD ISP site that many of you have accessed for years, please don't hesitate to reach out to us. All right, at this time.
Hey, Drew, I have a question.
Oh, please.
Who should we reach out to in order to get access? Do you want me to take that?
To our site or to the state site?
It was asked while you were talking about the Ohio ISP, so I'm guessing, both.
Okay, so for Summit DD's provider portal and iData system, you can reach out to provider support and we will support you to get access. For the state site, Mary, is that reaching out to DODD's IT system or IT call center?
Yes. So any provider who is connected to an Ohio ISP will it is already connected. All of our active providers are already connected to that. You should be able to log into the OHID site. If you can't get into OHID and you're getting errors, you can reach out to DODD's IT help desk. I'd recommend you reach out via email, but you can call them too. If you continue to run into issues, please reach out to provider support because sometimes we can assist you with troubleshooting, telling them what the issue is. So we've had that occur as well.
All right, thanks, Mary. All right, so at this point, I am going to turn it over to Matt Klink, Summit DD's IA analyst, to share some information about MUI. Matt?
All right, thanks, Drew, and thanks to everybody for coming today. Just wanted to take a minute and review that it's MUI annual report time, report season. This is the process where all providers are required to count their MUI categories that were filed for the previous year and compare them to the 2 years prior to that, and complete the MUI annual reporting form. And the idea is to look for any trends and patterns that emerge year over year. So the rule requires that all providers complete this process no later than January 31st each year. So you should have already done this, but you have until the end of February, February 28th to be exact, to send it in to the MUI department for our review. If you are wondering what this is, Summit DD's MUI department sent out the blank template at the beginning of January and a reminder email at the end of January. The blank form is attached to that, so please take a look at it, download it to your device, make sure you save it before you start to work on it, then save it again before you try and send it back in. We unfortunately get a lot of blank templates sent back in, and it's just because folks didn't save it to their device before and after editing. So when you're done with your analysis form, you can email it to the email on the screen, uilogs@summitdd.org. It's noted in the email request that you received, and it's noted on the form. So that's there for you to refer to. If it's easier for you to fax it, that's the MUI department's fax number right there, 330-634-8553. And we get a lot of questions that, hey, I never had an MUI. I've never, I didn't serve anybody last year. It doesn't matter. Just put 0 if that's the case for the year in question. And if you weren't a provider in one of the years that you're being asked about, just put NA or I wasn't a provider or 0, just to let us know that there wasn't anything there. Most of the questions that we've got can be answered in the email request itself that went out. But if you want to see some other tips and tricks to filling out your report, you can locate that link there at the bottom of your screen. I think we can go to the next slide. All right. And just an advertisement, we've been seeing an ongoing trend with misappropriation and exploitation over the last several years. And last year was no different. We saw our highest totals in each of these categories that we've seen in the past. So Detective Joseph Black from the Summit County Sheriff's Office and I are offering the second and a 2-part training opportunity for misappropriation education. If you're interested, we'll touch on specific information that we're seeing within the misappropriation and exploitation trends that we're seeing. We'll also discuss some red flags to keep an eye out for and prevention strategies. And then if an incident does occur, how you can support the individuals that you serve. There's the Sign Up Genius link right there at the bottom of the screen. A little more detailed information was contained in the MUI quarterly newsletter that went out a little bit ago. I think it went out beginning of January, and also on the Summit DD Providers website. So if you ever have any questions about MUIs or UIs, you can always send an email to the UI logs email address. I'm 99% of the time I'm going to be the one seeing those that come in there. So you'll probably get me, and I'll be happy to answer any questions you have about any process. And just one other note, I just wanted to mention about the MUI annual reports. That's a distinctly different process than UI log requests. MUI annual reports only concern major unusual incidents, as opposed to the UI logs, which only concern unusual incidents. And again, those are two separate processes. And currently, we request one monthly UI log per provider per calendar year. So those just started going out this month. So if it looks like you got 2 requests from us, you might want to take a closer look, because one of them might have been a UI log request. So all right, that's it.
Hey,
Thank you.
Matt, we had a couple questions.
Okay.
Just clarification from somebody asked for clarification. We did not have an MUI at all last year. Do we still need to log in and do this?
Still need to complete the form per the MUI rule requirements for all providers. So yeah, if you didn't have any MUIs in the years that are requested on the form, just write 0 and make sure you put your name and date it and send it back in.
And the other question was regarding the training. Will that be virtual or in person or both?
Will be a hybrid. So I believe if you want to come in person, we're going to be at the Cuyahoga Falls Center, but otherwise it'll be virtual. And you have to make a selection on the Sign Up Genius. When you go to sign up, it'll prompt you to make a selection either in person or virtual.
Thanks, Matt. That's all the questions right now.
Thank you.
Hey, thanks, Matt. Thanks, Mary. All right, just wanted to touch base on local billing. We know that there's been kind of several transitions relative to local billing processes kind of over the last 5 or 6 months with the transition to the new county vendor system, Munis, in addition to us transitioning away from OhioDD.net and moving local billing over through BritCo. So as you can see on the slide, just a couple different things. If you have not yet billed for all of your 2023 claims, please submit those separately than any current 2024 claims that you are looking to be paid for. The county requires all 2023 claims to be on a separate invoice, so we are not able to process an invoice that has 2023 claims in addition to 2024 claims. So please be mindful and bill those separately. We are going to continue, as we mentioned at the last provider meeting, and moving forward, we are going to be processing local billing claims as they come in. We had historically always kind of communicated submitting them by the 10th of the month. As they come in, we'll process them and move them down to the county for payment. So if you want to bill every 2 weeks or whatever frequency makes sense for you, please do that. We'll process them as they come, and you will receive payment through the county. Just from a timeline perspective, we get asked this quite a bit. You should receive payment generally between 30 and 45 days from the time that you submit that information. We process it, we send it down to the county. The county's timeline has always been 30 to 45 days to pay vendors. So just be aware of that timeline. We know it can happen a little sooner, but in general, that should be the expectation, is that once you submit claims, you'll be paid somewhere within that 30 to 45 day window. Also, just if you are looking in Britco to see updates on information and you see the paid notation in Britco, that just means that we have processed it and sent it down to the county. That does not mean that you should have received payment. So if you look at that and you see paid and you notice like, oh, I haven't been paid yet, that's because that's just noting from a Britco kind of language perspective that we have processed it, sent it down to the county, and the county is working through to cut you a check or do direct deposit. But it has not officially been quote unquote paid yet. I know local billing has been an issue, so maybe I'll just stop and see if there are any questions in the chat, or if anyone wants to unmute themselves before we start talking about medication administration. If anyone has any questions around local billing.
There right now is one question, but it is actually about the UI log. So this one's for you, Matt. It says, may I clarify
I was actually just typing in, but I'll go ahead and answer it.
Okay.
Yeah, providers are required to maintain a monthly log of UIs, but you only need to worry about sending it in if you get a request for a specific month.
And there are no other questions right now.
Okay. All right. Sounds good. Thank you, Matt. Thank you, Mary. All right. Medication administration. Just wanted to talk through medication certification requirements and kind of the process. So kind of on this chart, what you see is kind of the 3 outcomes of the self-administration assessment. When an SSA in collaboration with the team assess the individual's ability to administer medications, or if they need assistance. So the outcomes of those assessments are kind of at the top, where you're going to see self-administer without assistance. So they can complete all the steps. They're going to be able to access their information, be able to identify the medications that they take. And at this point, no one is really helping them manage their medications or be able to take them correctly. Then it can be self-administer with assistance, or able to self-administer with assistance. And in those situations, they're really just going to need some time reminders or some physical assistance, but the individual knows their medications, they understand the purpose, and they're just looking for some prompting, or maybe some physical assistance based on their specific needs to be able to take that medication. There will be information in the ISP around this. There isn't a MAR that's needed, but on like your documentation sheet, if you're the individual or the provider providing some of these supports, you would want to put assistance with administering medications on that service documentation, so that it's clear that you as a provider are helping to support that, which should be outlined in the ISP. No, you're not required to be not required to go through medication certification training if this is the situation you are in. So if in that ISP it says able to self-administer with assistance, you understand the assistance you're providing as time reminders or physical assistance, but the individual understands the medications they're taking, and is able to do that. With some of these supports, you don't need to go through that training, but we'll want to document the support that you provide through your own documentation. And then the next one is unable to self-administer with or without assistance. So this is where someone is going to need kind of full support to be able to take their medication. They may be able to do a couple steps or some steps, but they're going to need additional support beyond just a time reminder or some physical assistance. Maybe they don't understand the medications that they take. They don't know what they are. They wouldn't know when to take them. And then, so the ultimate is without some more support, they would not administer their own medications. This is where you need to have medication certification training. As many of you know, Summit DD provides space to nursing navigators to be able to offer MedCert training at Summit DD's Cuyahoga Falls Center. The ISP will outline all of this, the steps they can do, and then what you are going to do as a paid support. There's a MAR that's going to be required, and then you're going to be required to maintain that certification to be able to support that person. And everything relative to the results, the ISP information, the documentation that's required, and then the provider certifications right there. Just outlining the different categories of medication certification. You got category 1, which is going to be your oral, topical, and inhaled medications, as well as health-related activities. To receive that certification, it's a 2-day training. Like I said, nursing navigators who utilize this space here at Cuyahoga Falls to offer that training. You can sign up for that training. The dates are on Summit DD's provider website. And then I believe the cost is $125 for the 14 hours. And then you take a test, and then you have that MedCert training, and then you can support individuals who need that help. Cert 2 is being able to administer medications through a G or J tube. This also requires nursing delegation, which we will speak to a little bit later in the slides. But you're going to be required to have Cert 1 first. So they kind of build upon each other. So you got Cert 1 is the base. If you're then going to support someone who needs medications through a G tube or J tube, then you would get Cert 2, and then that would also require nursing delegation. And then category 3 is administering insulin or injectable treatments, and that also requires nursing delegation, and you must also have Cert 1 certification as well to be able to obtain Cert 3. I will say, if you are just administering insulin and you're not supporting anyone for G-tube or J-tube, you can just have Cert 1 and then Cert 3. You don't also have to have Cert 2. There are also several standalone trainings that are also required if you are supporting someone with like a VNS nerve stimulator or an EpiPen, and you can you would also need Cert 1 for that, and then you would receive these individual standalone trainings. So for instance, if you are an NMT provider and you have an individual who is severely allergic to bees, and they have an EpiPen and they would not be able to administer it themselves should they be stung during transportation, you would get Cert 1 training and then the individual EpiPen training as well. This is also sometimes provided at first aid, and it would be noted on your first aid certification that you've also received EpiPen. But if not, if you are coming for Cert 1 training specific for EpiPen usage, please ask the nurse to ensure that you receive that, so that you could potentially get it within the 2 days that you are here for Cert 1 or VNS as well. And if there's other things, please do not hesitate to talk to the nurses providing that training. All right, so medication administration assessments. You as a provider who support people should be involved in this. If you are working with that individual at a time where they may be taking medications and would need your support for that, it's really, that assessment is completed by the team with the SSA. And these are just some considerations. It'll be done in each environment. And it will go through the assessment. Individual will participate as well. And then once everything is identified and based on the outcome of that assessment, the ISP will be updated. And then obviously, if you need to obtain certification training, you can certainly do that. And then you'd be able to support that person if they need that support. There is also something called family delegation, and this applies only to independent providers. And this is in a situation where you are providing drop-in services to an individual who is living at home or with their family, their immediate family. So this isn't a situation where you'd be providing drop-in services to someone who lives alone in their apartment or with a roommate. This is only in situations where the individual is receiving drop-in services and they're living with their immediate family. That immediate family can train you to be able to administer those medications. That's a team conversation. There's a form that needs to be completed and it's documented in the ISP. And then as medications change, the ISP and that training is updated as well. So this is kind of the one outlier in a situation where someone may not be able to self-administer their own medication, but is living in with their immediate family. That family can then do this family delegation, and you would not need to obtain that training, but it only is available in this specific situation, not in all situations. So if an individual is living alone, the family cannot come and delegate you. You would need to receive Cert 1 training or Cert 2 or Cert 3 based on the individual situation. It's only when they're actually living with immediate family that family delegation actually applies. And it can't just be this agreement between you and the family. And it really needs to be a team conversation so the appropriate paperwork can be completed and the ISP can be accurately updated. And that ensures that that individual is being supported safely and receiving those medications appropriately. All right. So just kind of a chart relative to, when MedCert and MARS are required and when they're not. And kind of goes through some various scenarios. So like we just kind of talked about, someone living alone, living with roommates, or is in a congregate setting or a non-related shared living, the person needs support and is unable to administer medications independently. You're going to receive that Cert 1 or potentially Cert 2, Cert 3. There's going to be a MAR required, and you're going to follow medication certification rules and regulations. You're living with a family provider, kind of shared living, you're a parent, then you're not going to need MedCert to be able to support the person to receive medication. You would just administer medication on doc sheets so that it's clear that part of the support you're providing as a family member through shared living is helping the person to administer medications. And then the last one is just the one I just talked about through the family delegation is you are an independent provider going into a home to support an individual who lives with immediate family who needs support from medication administration. The family can delegate you through the family delegation process, and then you would just identify that you are supporting medication administration on the doc sheets as part of the services that you're being reimbursed for. But please ensure that that's a team conversation. The ISP is reflective of that family delegation status. All right. If you do support someone and you do have Cert 1 or any other medication certifications, and you're documenting the administration of meds on a MAR, here is all of the requirements that need to be on that MAR. Most pharmacies can give you a MAR that would have these, and then you would just fill it out, sure that it's signed. But if you don't have a MAR and you need one because you're certified in passing medications, please reach out to provider support. We have quality assurance nurses who would be happy to talk this through with you. There's certainly sample MARs out there that they can help you with. So to ensure that you're documenting the administration of medications correctly. All right. If you are a backup provider for someone who cannot self-administer, you will also need to have medication certification in case you are called upon to provide those supports. If an individual is using like a pill box or a pill minder, only a nurse, a doctor, a pharmacist, or a natural support can fill those. You as a provider, even if you're certified, cannot take medication out of a pharmacy labeled container and put it in a pill minder. The only time that you're able to remove medication from a pharmacy labeled container is to support the administration of that medication to that individual. You cannot, as a certified staff, fill a pill minder for an individual who cannot self-administer. So just be aware of that. We've had a couple situations recently where it was identified a certified provider would fill a pill minder, and that is a violation of rule. So if you're in that situation or you need some support around this, please don't hesitate to reach out to provider relations. And then you just need to make sure you're qualified and certified and appropriately trained for any of the medication administration supports you may be providing. And, you know, I provided the example that's kind of written here around that NMT driver and the EpiPens. All right, nursing delegation, we kind of talked a little bit through this. Is if you are, you know, Cert 2 because you're helping someone receive medication through a G-tube or J-tube, after you pass Cert 2 class, you're going to need delegated by an actual nurse. So the nurse will come out, they'll assess the individual, and then they'll train you individually and be available for questions on how to perform Cert 2 related tasks. Same thing goes for Cert 3. You cannot just get Cert 3 training and then go back and start injecting insulin, or from a Cert 2 perspective, put medication through a G-tube or J-tube. You gotta have a nurse come out and do that individual delegation. If you have questions about this, once again, please don't hesitate to reach out to provider supports, and one of the nurses will be happy to help. All right, just kind of a word, if you are passing medications and you are not certified, please reach out to us ASAP so that we can get you connected to the proper supports and the proper training. If you aren't sure if you're certified, you can find that out on DoD's website. The link's right here. And then once again, the email address to provider supports is there as well. And then here's our nurses. We've had some new nurses join our team over the last year. And we have now 3 QA nurses that are available. You'll certainly see them if you are an independent provider who's going to participate in a QARN assessment. But they're also here just to answer any questions around medication administration, family delegation, or medication certification. All right, so I know that's a big topic. Anything in the chat, questions that I can answer around this?
We had a question regarding the sign up for first aid CPR. So that's already in the chat, where you can sign up for first aid CPR through Summit DD, and also where you can sign up for the medication certification classes through Summit DD. You do not have to take them through us, but you do have to take them from somebody who is able to provide those. So with first aid CPR, I know a lot of times we run into the training may not have an in-person component, and that is now required again. So if you're taking it not through us, just make sure that you have that full component and you have both first aid and CPR. But there's no other questions.
All right, thanks, Mary. All right, 8-hour training requirement. So we have, through the compliance process, run into situations, unfortunately, where independent providers have not completed the annual training requirements. So we just wanted to review them, answer any questions, and then just provide some additional information to make sure that you're completing all of the rule-based training that is required to maintain your certification. So first off, as Mary just talked about and we just put in the chat, CPR first aid with an in-person skills assessment is required to be valid at all times. That is an absolute requirement of independent certification. So just please continue to keep that up. We offer it here for a minimal cost, but you can also access it in other places throughout the county, Red Cross, other trainers, but please ensure that that in-person skills assessment is occurring. We are aware of situations where there are ones that are advertised as online only. Unfortunately, that is not going to meet rule. And if you're going through your certification or a review and a reviewer is asking for that, and there hasn't been that in-person skills assessment, it's not going to be viewed as a valid CPR first aid. All certification and research training is available on DoD My Learning. DoD made these trainings all virtual, I think right around COVID, so that they can be done at times that are convenient for you. Within the independent provider rule, you have to complete annually 2 hours of training that is provided by DoD. It's on their online learning, and it must include it's a DoD provided curriculum, and it takes about 2 hours, and it includes the items listed here. Then you have to complete an additional 6 hours on training that's relevant to components of quality care, health and safety, positive behavior support. All of this can be accessed on My Learning. So you don't necessarily have to go to in-person training to receive that. You can just access it online, but please ensure that you get those 8 hours and that you do that annually per rule. If you have questions about that or accessing DoD My Learning, once again, please don't hesitate to reach out to provider support. We're happy to meet with you and talk you through how to access and then what those annual training requirements are. If you are a provider that is only certified for the services listed here, you have alternate training requirements that can be found in rule. However, if you are also certified for one of these and like HPC or and NMT, you must complete the 8-hour annual training. But if you are only certified for home delivered meals or only certified for environmental adaptations, there are separate rule training requirements. But if you happen to even be certified, doesn't mean that you're delivering it. It just means that like you're certified for HPC or NMT. The other annual training requirements absolutely apply to you. So if you happen to be in that situation, look at your certification, have questions. Once again, don't hesitate to reach out to us. Certification rule, we link it here. It's also available on the DoD website. I'm sure all of you are familiar with that. And so just be mindful as you are continuing to maintain and renew your certification. All right. Last, before we get to some of our miscellaneous updates, I just wanted to very briefly give some information relative to the total solar eclipse that is going to be occurring in Ohio. So on April 8th, Ohio, specifically in Summit County and Cleveland and kind of west, we are going to experience a total solar eclipse, which means that we are in the path of totality, I guess, for lack of a better word, where the moon is going to be fully blocked by, is fully going to block the sun. Reason why I'm talking about this is the timing. Many of you who might have kids, grandkids, or no kids know that schools are very much closing on this day, and it is not just to allow kids to be able to experience it, though that is definitely a side benefit of this, is because of when it's occurring. And the amount of increased visitors and traffic that is going to occur because Summit County is on this path of totality. The eclipse is going to start at 2 o'clock and end around 4:30 for about 15 to 20 minutes. It will be as dark as night because we are in that path of totality. It is obviously when people are leaving school, when people are leaving day services, people leaving work, all that. And it is potentially estimated that we may see an increase of 1 million visitors to Summit County on this day. So a significant amount of increased traffic and visitors, which is going to significantly impede people's ability to get around during that time. And so that's why schools have canceled, because that's obviously during dismissal time, and being able to take a bus back home may be a real challenge. I listened into a county webinar about this yesterday, and one of the presenters talked about one of the total solar eclipses that occurred where Tennessee, part of Tennessee was in the area of totality. And he articulated that it took him an hour to get there, and then took him 6 hours to get back, because of how much more traffic had occurred as a result of visitors that were coming in to see the eclipse. So just be mindful, if you're an independent provider who's doing NMT and you're picking people up from day service around this time, you may experience significant traffic that will prevent you from being able to move around the county and drop people off at kind of the regular pattern that you're used to. I have not heard of day services that are planning to close on this day, but I would not be surprised if that occurs. But just be mindful of it, and be planful. That, if it typically takes you 20 minutes to bring someone home from day service, if it's right around this time, that is not going to happen, and you may end up out on the road for several hours trying to drop people off. Also, if you are supporting people who want to view the eclipse, please ensure that that individual has proper eyewear. You can significantly damage your eyes staring at the eclipse without proper eyewear. And I do not just mean sunglasses. There are actually ISO certified solar eclipse glasses that can be purchased online. They are not expensive. In some cases, you can get a pack of 10 for $15. But please be mindful of that. We certainly do not want anyone to be injured as a result of wanting to view, potentially a once in a lifetime event because they were not provided the proper eyewear. So, if you're a shared living provider doing drop-in, and the individual you support is going to be interested in viewing it, please ensure that they have the proper eyewear so that their eyes are not unintentionally damaged. And then just a map of where the solar eclipse will be around Akron and what time. So you'll see right around 3:15 is when they anticipate kind of the full solar eclipse being viewable in the Akron area, which means it's going to be basically like nighttime for about 15 to 20 minutes. If we hear of day services closing, obviously they're going to communicate that. I already know the county is changing operations. I anticipate us having limited staff in the buildings as a result of the timing as well. So we'll continue to communicate any additional information around this. All right, lastly, just some miscellaneous updates. We have also spoken here about the Free Choice of Provider work group that we have that is kind of reviewing how individuals looking for service connect to providers that can provide those services. We have mapped out kind of that entire process, and now are really looking to get feedback from persons served, families, and providers around their experience and the process. So we'll be sending out surveys in the next 2 to 3 weeks to seek your feedback. Your feedback is incredibly important to this process because you're a critical piece of the Free Choice of Provider process, because we have a person served looking for service and a provider that's indicating that they are a willing and able provider. And we want to support and facilitate the best matches as possible between people looking for service and providers who are able to offer that. So if you get this survey, please fill it out. Please provide your feedback, because we want to ensure we have the voices of all the people that are impacted as part of the Free Choice of Provider process, so that we can ensure the recommendations and the outcomes of the work group are reflective of everyone who engages in this process. Also, we've talked about the change in residential respite. It is now also going to incorporate 15-minute unit billing, which means it is going to be EVV, a service that will be required for EVV documentation. The Ohio Department of Medicaid, who monitors the EVV rule, is going to be updating it to include 15-minute residential respite, and that rule will be effective July 1st. Just relative to just general updates that are put out by DODD, if you are not subscribed to Monday Memo, which is a weekly email and newsletter that's put out by the department that has really good information that providers need to know, there's a link to subscribe to Monday Memo. We had talked about this at the most recent agency provider meeting, but January 17th is like a great addition of the type of information that gets put out in the Monday Memo. But I would really encourage you, if you are not subscribed to that, to please subscribe to it. And is how DODD communicates with the provider community is through email, through these kind of newsletters. So just so you're aware of all the things that are going on in the provider community, some of which may impact the services you provide. So I would just encourage you to sign up if you have not already. All right, so that is it. I'm going to stop sharing my screen, but see what's in the chat.
We
I don't
had
see-
a question regarding training that came through that I answered in the chat, but just in case anyone else had the same question. For the 6 hours of additional training that you need, the 2 hours are required. You have to do them through DODD My Learning. Those additional 6 you can do in DODD My Learning. Then they'll be in there, and you can print off your transcript that they're complete, and choose from different options there. But you also can do those through different trainings that you can access online or in person. You could go, if you're working with somebody that has diabetes, for instance, you could go to a diabetes education class or something like that the hospital offers. So you'll want to, if you do that type of training that's not through DODD, I put a link to the tracking sheet that you can use to document that information that you'll need to turn in when you recertify or and whatnot. And yes, I can throw the link in for the question was the link for the Monday Memo to sign up for that. I'll put the link for that in the chat.
There, I just put in the chat. Any other questions or anything else that anyone would like to discuss while we're here? Yeah, Tammy, go ahead.
Can you tell me when the next provider meeting will be?
It will be April. Hold on. April 10th at 2:00. We will include the list of all of the scheduled independent provider meetings that we identified at the beginning of the year. We'll put that schedule out when we send this out. All right, any other questions? All right, well, I'll hang out for a minute if anyone does. Appreciate everybody's time today, and I hope you guys all have a great rest of your week. All right, well, I appreciate everybody joining. Have a great day.